Hello, everyone, and thank you for joining us today. There are a lot of people on with us today, so you've either gotten very bored and made time for me today, or we've got a hot topic here. So without further ado, welcome to Mental Health Marketing. Will the real addiction expert please stand up? Owning the marketing narrative in the addiction treatment space. And today's topic, I will be sharing a little bit of something for everyone. I think this will please the branding audience, the marketing audience, and we'll be discussing just general messaging and narrative control. So glad to see so many people showing interest in that. About your presenter, I'm Dan Gemp, the real healthcare digital marketing expert. You'll see why I'm making that claim momentarily. And I've been running Dreamscape marketing since 2005. We've worked with mental health groups in 37 states, launched over 600 websites in the space, run and managed over 400 digital marketing campaigns for substance abuse, primary mental health, really runs the gambit, and have a team of 61 people now. We've actually added a few folks during this crisis communication effort, and looking to grow. So without further ado, this webinar is brought to you by Dreamscape Marketing. I will try to avoid shameless self-promotion and just share useful information today, but thank you again for attending. A little bit of administrative information here. For Q&A, you can submit a question on the bottom left of your screen at any point during the presentation. All questions will be answered during the last 10 minutes of the program today. For resources, you can find a PDF of the presentation and additional resources under the headshot image located on the left of your screen. If you need help or assistance at all during or after the webinar, you can email Melissa Pangaro at mpangaro@naccme.com. For NADAC credit information, to receive credit, you must watch the program all the way through to the Q&A section at the end of the presentation. Do not leave the console. Also, I'll keep it entertaining. Please continue to stay on the platform and you'll be automatically redirected to an evaluation landing page. If this is your first time attending a webinar in 2020, you will need to create an ACME account when you are first directed to the landing page. For all subsequent webinars you attend, you will already have an account and will just need to log in. After completion of the evaluation, you will be able to download or print your certificate. NADAC credit is only offered for the live broadcast. Speaking of the live broadcast, let's dive into it. So today's agenda is going to mix opinion, brand perspective, and observation. There is a massive opportunity in the market of substance abuse and mental health to still become the foremost leader in the space under any standards that might mean to you. So during this presentation, we will walk through the marketing mix required to stake your claim and build your organization into a widely recognized clinical authority. And again, to some of you, that's going to mean branding. This may resonate as branding. To others, it is a marketing campaign, and I'm breaking down the components you'll need for a successful, broad scope market activation. And then at the executive level, what we're really going to be covering as a strategy and the specific tactics behind that strategy is narrative control. And it's highly relevant to what we're all going through today. I hope you're all staying safe. I hope your loved ones are all staying safe, but a global pandemic is a very rare occurrence, and the communication from leaders of all organizations is being highly scrutinized. And you'll see that at a gut level, you're responding to certain healthcare leaders, certain politicians favorably, and others with sheer disgust and disdain, and it's a very personal reaction to whoever is controlling the narrative. But we're going to go through how to effectively do that, how to win, and how to establish market dominance, how to be a thought leader. So first, we'll define this opportunity, right? What does that look like for you to become an addiction expert? And this is both clinical and marketing. So again, realize today we'll be tuned to multiple audiences. And how is that going to benefit your organization and your patients, right? This is still a patient-first methodology that I'll be describing today. We'll make sure that you can all understand the importance of establishing a thought leadership role. Essentially, why would you want people to know your name or your facility's name? What is the value and benefit of that? Then I'll make sure that we can go through and recognize the key data sources needed to market this content, right? If you write the world's best research study, but you don't know where to put it, that's going to be a failure. But if you do know where to put it, you can have global impact. And then either on how to build your team or utilize your team's strengths to support your marketing strategy. And I'll even get into who I had to tie in for my team to fuel the research and the development of today's presentation. And I want to make sure that everybody at the end of this webinar feels comfortable that they could deploy a marketing campaign that controls the addiction treatment narrative. And I mean this from a personal level on a national scale. I believe that there is not currently a clear leader in the space. So defining the opportunity, why do I believe this topic is relevant not only to the here and now in the midst of a pandemic, but why do I believe that there is a leadership vacuum, an empty seat at the top of this industry that someone can truly step into and lead? This is a massive impact on society. Mental health is going to get worse during this crisis. We're going to see not only the impact of market downturns, but we're going to see new and predictable, outcomes from social isolation, loss of employment. And this is going to be very dangerous for our society right now. So the opportunity to lead from an organizational or individual brand perspective is where we're going to take the conversation today. This is what causes me to say that there is not a clear leader in substance abuse and mental health in the United States. And when I say clear leader, I mean that from a commercial perspective. Who is the one brand that every single American would tell you is the leading addiction treatment company in the world? So if we surveyed the general public on the authorities in healthcare, right? Let's just look at healthcare as a whole. We'd most likely get the same answers pretty consistently on a national level. The Mayo Clinic, Johns Hopkins Hospital, the Cleveland Clinic. These are go-to answers, right? These are the groups that have developed an undisputed reputation of trust through the outcomes of their work. There is a depth of transparency. I often reference that the Mayo Clinic's survival percentage, as they publish and advertise it for stage 4 pancreatic cancer, is barely above 1%. But they proudly market that because it's simply the truth. It is the likely outcome going to one of the leading institutions on the planet, if not the leading institution on the planet for cancer care. And we all agree that that's about as good as it gets. So it's not that they've invested so heavily in branding. They have invested in controlling the narrative, backing up that narrative with research, publishing that research, and making sure that they employ people and projects that are highly relevant to society. This is where it gets interesting, though. From my perspective, as a well-positioned marketing agency in the space, right, there is no such undisputed national voice in addiction treatment. We are in a segmented and decentralized sector of healthcare. So while we're in this vacuum, right, and this vacuum is a commercial industry worth tens of billions of dollars a year, it is a leading cause of death in America, and we are not trending down, unfortunately, due to current conditions. Mental health is going to keep trending up as a medical need. So while many, many organizations are at enterprise scale, there is not a preeminent thought leader. If you asked one American in all 50 states who the thought leader is in addiction treatment, you will not get the same answer from all of them. And you will hear social influencer answers as frequently as you will hear clinical expert answers. You'll hear references to TV personalities. You may hear Oprah come up more often than not as a preeminent thought leader in the space. And if that strikes you as odd, we're going to take this in a whole different direction today on how to control that narrative and who is actually doing it that has no commercial interest in the space. The fact that there's no governing body, and I don't mean that there aren't trade organizations and membership groups that are fighting the good fight and helping to pass legislation. I even know individuals in the space that contributed highly to the parity laws that were deployed through Obamacare. They're still in place. But there is no single results leader. There is no treatment center or operational group or private practice clinical that from a results basis and outcomes basis has been able to publish themselves as the foremost expert in the space. To that degree, without that data-backed position, right, Johns Hopkins, Mayo Clinic, Cleveland Clinic, their marketing, if you even need to call it that, their published thought leadership is based on data and research. So I would make the argument today, as we look at the opportunity, that there's not really anyone even effectively publishing and distributing any conclusive data on the outcomes of their treatment. It is beginning. There are outcomes tracking companies. There are many of the larger commercial groups that are starting that process. But as of today, there is not a definitive leader. So the opportunity still exists. There is an empty seat that any or all of you or a collective of you can become notable brands and notable influencers in for the rest of the industry and for the country. So this actually gets even more shocking when you consider the death toll, right? This isn't impacting a few people. This is essentially substance abuse and mental health concerns do impact just about everyone. Okay, there are very few American families that can say they're not impacted directly or indirectly by addiction and by mental health diseases. So as an industry, as a healthcare sector, right, what's kind of cool is what I like about this space, whether for-profit or nonprofit, is that business success really is clinical success. For you to have any long-term business growth and to employ the best of the best and be a place where people want to participate in your clinical programs, you need to have strong clinical programs. And as a marketing group, again, I always need clients to have a strong approach to clinical to be successful at ever establishing a brand. So looking into the future, right, who is going to still be here 10 years, 20 years from now? And who might be a dominant brand? Who might be a Johns Hopkins of addiction treatment? To secure your futures, those are going to be cemented by whoever's staking their claim here and now today, right? As you saw me shamelessly self-promote earlier, I am claiming to be a marketing expert in the space. Maybe not the foremost, but a marketing expert in the space. And that's due to a scoreboard. I see statistics and data that back up a long-term track record and outcomes, right, that have gotten over 100,000 people into treatment programs. I want to know from the clinical side and at a wide variety of treatment centers, what are you doing today to establish thought leadership and trust in your facilities, even in your private practice? So thought leadership and trust, those are the goals of what we're going to describe today in the opportunity. In the addiction treatment market, there's a significant public need for more information. This is a stigmatized disease. Many Americans don't even understand the disease nature, a compulsory disorder at all. They don't realize the chronic condition, that this is very similar to even diabetes, right, or any other chronic medical needs. So in addiction treatment, information is lacking. People often live in doubt and denial. Some of these relationships are toxic, and that actually keeps people from seeking out this information. And I think that the leadership from non-stigmatized providers is a little bit old school. I think that many of the more reputable groups don't market enough their long-term track record, their clinical program strengths, and then some of the newer programs that are just well-funded are screaming from the mountaintops, but they don't have the data to back up the leadership. So they can brand and they can gain market share and they can grow as a commercial entity. But if you ask any American, hey, who are these guys? They wouldn't have heard of you. They'll still say Oprah might be a, more clinically relevant leader. And I hope you don't think I'm joking here. I'm being quite serious. It is still early enough to control the narrative on a national scale to benefit your organization, your patients. You may still be, and when I say you, I'm saying as an individual, whoever's listening to me right now, may still be the preeminent national leader on substance abuse and addiction treatment. And think about long term. I see Dr. Fauci on TV all day, every day, as the foremost expert on epidemics. But he's been in the same job for 40 years. I certainly hope he is. I don't know. But he is presented as that leader. And he has access to the broad market right now to present information. So to be in that position, right, we have to understand how brand establishes marketing authority. How do you get to that level of credibility, knowing that some portion of it must be manufactured, right? How do these people attain fame and clinical acumen? And if you're busy practicing what you're good at, then how do you have time to write 12 books about it? So I'm going to dive into it, and we're going to talk about the tactics today. So first, we need to understand branding versus brand, right? This isn't just for, your standing desk, Mac using philosophy major hipsters anymore. They all work for me. When we talk about our brand, many of us are immediately thinking about a company logo, colors, fonts, websites, brochures. You're thinking of a corporate brand. You're thinking of elements. You're thinking of specific deliverables from your branding efforts, but not the market perception of your brand, okay? Not how people identify with you. So those are simply designs that have been developed to visually communicate underlying thoughts like mission, vision, values. And I'll prove this to you in a second. But the philosophies that collectively comprise your brand, and that brand is an answer to questions, right? So how do you establish trust through a brand? How do you market a brand? Well, they answer questions like, why does our organization exist? What are the principles that guide us? And how do we conduct our work? So let's go back to these national examples, these leaders and titans of medical marketing that aren't really even marketing, and this brand versus branding concept. So the difference here might seem minimal, but I'm telling you it's critical. I think that that's the difference between leadership and advertising. I would bet that none of you could accurately describe the Johns Hopkins logo from memory. If I just said Johns Hopkins, Johns Hopkins, Johns Hopkins, I don't think you'd be able to describe the logo or draw me a picture of the logo. And probably the closest you get would be, the colors of their athletic uniforms. But I'd also bet, at the very mention of the name, that you have a feeling in your gut that this is a reputation-based feeling, and that it is a credibility feeling, that if Johns Hopkins was about to give you important information, you would probably trust it. So the feelings that you're having, these derive from an awareness, right, of their medical successes. They've been educating you about their medical successes for decades. They've been leading you to this level of trust, not marketing, but leading you. And it is brand trust and brand value. But their successes are the result of their adherence to this set of ethical values, practical standards, and moral responsibilities. Their clinical research is what has produced positive outcomes that the public trusts. It's what leads them in the medical advancement efforts they're making. That is their brand, and you're aware of it because they publish it on the first banner of their website, in fact. So their branding, right, was an approved logo for use on uniforms, buildings, and signage, right? Their branding is, a little yellow triangle next to their name in a specific font that's probably highly customized and very expensive. But their brand is a national leader in care. They even have specific ratings. Number 3 in the nation, number 1 in Maryland, according to the U.S. News and World Report's 2019 to 2020 rankings. That's a brand. How many of you right now could confidently say, based on any kind of third-party credibility, that you are number 3 in the nation and number 1 in your state as a national leader? And I mean at whatever level of care you might be providing. So to this point, you need to realize that your outcomes then are your brand. You stand for something, you have a mission, you have an underlying ethical standard that everyone in the organization is deploying. You've developed a culture And so your most valuable marketing collateral is going to be your outcomes. And this is an industry with, massive recidivism and relapse, and you're not going to beat that. But your competitors aren't doing any better than you, right? And so you simply need to speak about it openly. You'd be surprised as high as your AMA walkout rate might be, the number of people leaving against medical advice from your program. Yours might be half what your competitors is, because your clinical care is so strong that your staff is making a personal connection to your patients. And that one data point, that one little piece of outcomes data where you're talking about, a slightly lower AMA rate than others in the market, that is where you can lead. That is what you can talk about publicly. You can publish papers on how you designed your residential facility to, make people have to take a really long walk from their rooms to the lobby door to leave. Whatever that might look like. I'm being overly oversimplifying here, but the concept would be this. You can have a modern logo, a beautiful website, catchy ads, a fancy lobby, and framed diplomas. That delivers, it might alleviate fear, it delivers some hope, but that's just corporate presence. Those are just the elements that people would expect at any enterprise healthcare group. So building reputation, a reputable image, a positive patient experience, that can only be done at the clinical level, and it can only be tracked through clinical outcomes. So at decision time, when we're talking about trust and reputation and things that could be skewed with fame, families are buying into trust. They want to know that they're making the best decision for their loved one. More than 70% of the time when your phone rings, it's from a concerned mother, not spouse, not just female. A concerned mother is calling you 70-some% of the time. So they're looking for the best chance at a positive outcome. If your data bears out a higher than industry average probability of delivering a positive outcome in your care, then you become the clinical authority. People don't expect there to be a cure for addiction. And often I've heard many of you say back to me, Dan, I get calls every day where people are essentially saying, fix my kid. And that's because we have an uneducated consumer base. It's because you have failed to establish yourself as the thought leader and educate families on the disease state of addiction and the probability that there will be relapse in their loved one's life, but what they can do about it and what they can do preventatively. So using this data, using any kind of positive outcome, right, will inform a consumer that they have higher than average chances. They have higher than average hope if they engage you for your services. And so it's odd to say that in your marketing and in your branding, what you're really delivering is slightly more hope of a possible outcome that you have a high probability of delivering. But that is what you're doing here. That's what you should be speaking about publicly. No doctor, no surgeon cures 100% of cancer cases. Not everyone lives a very long time with diabetes, whether properly managed or not. So this is still healthcare with known outcomes, right, long term. But your position in the marketplace and your leadership can be built off of that. And I'm still very strongly saying that your authority, this authority is waiting to be claimed. You can begin now, and there is still plenty of time, plenty of opportunity. Even the largest commercial players in the space are just starting to truly effectively track their outcomes to get that kind of credibility and trust from families in the U.S. So what are these outcomes data sources? What am I telling you to look at? What am I telling you to make claims based on? What should you be speaking about at conferences and events and webinars? Simple statistics. It's not about the advanced clinical stuff that consumers need to know. When they're concerned that a loved one is going to die because they've been putting narcotics into their bloodstream, right? They're concerned more about, hey, is my loved one even going to complete your program, right? So what percentage of your patients go through treatment to the level you believe is sufficient? What is the relapse rate that you're aware of, and over what period of time is that? And you can be very honest about it, right? Relapse is a real thing. People are aware of that, and you can educate them on the probability and what they might be able to do to prevent it. Employment rate. Johns Hopkins just released a study that was very successful. For individuals in active recovery, if you increase their pay rate year over year, starting at minimum wage, the level of relapse dropped off dramatically, massively. So people that are gainfully employed and see the opportunity in increasing their income, they don't want to go back to square one. They don't want to lose that employment, that income. And so that kind of a statistic, right? Hey, 80% of our former patients and alumni still have a job 1 year after treatment. That one piece of outcomes data is very compelling to a concerned mother whose son hasn't held down a job for more than 60 days in the last 2 years. AMA mitigation, right? Do you have a specific protocol to avoid patients leaving? Do you leave a therapist sitting in a chair by the door every night, whatever that looks like in your corporate structure, to simply say before someone leaves, are you sure you want to go? There's a lot of risk in that. So you might have marketing opportunity and thought leadership opportunity in your approach to a specific one of these. You could employ an HR expert to help people find employment. You could customize an anti-AMA program to keep patients engaged and just try to talk them off the ledge a little bit if they're just having a bad day. Alumni testimonials. You don't have to be the source of this information. Your alumni, many of them will credit you with life-saving work, right? Many of them need your help again, and you can advertise the percentage of your alumni that you actively reach out to. And people trust that. That is a sincere type of marketing. If someone does need your services, they might come back. And so, yes, it is marketing, but you're staying engaged with what percentage of your alumni? Case studies. Do you have peer colleagues, other groups that, or specific types of treatment that you're best at, right? Hey, our women's trauma program has this success and this success. And then unique services. Not every group has unique services, but every group tells me how unique their services are. So this doesn't mean level of care. This means, based on location and things like equine therapy. Those unique therapies, yoga, a really nice gym, those are over-advertised as amenities and lifestyle features in the space, but really they're unique services that will help people who enjoy those hobbies to feel comfortable in your care. Marketing outlets, right? So where do you go to claim this authority? I'm giving you simple examples of outcomes data, but where do you go to tell people about that data? Well, step one is your blog and your website. Step two would be your own social media accounts. Medical publications and journals is interesting. You can request from medical publications and journals if they are working on any specific topics or would like contributors to cover any specific mental health topic. And then if you give them good content, they'll ask you to contribute more and more and more. That will allow you to start advertising conceptually the as seen in the New York Times, as seen in, Joe Schmo Medical Journal. And that evolves into authorship, right? You can author books or you can co-author books with another colleague, with a ghostwriter, whatever that looks like for you. But I am working on a book that describes the practice of authoring a book to claim expertise. Public speaking, right? The very fact that you're here listening to me right now defines the opportunity in this, right? If you were the one speaking right now about a relevant topic and there were hundreds of people listening, right, that can only turn into more opportunity and establish more authority so long as you know what you're talking about. Reputable mental health websites. These are not the lead gen sites. These are not, just directories. Are you contributing content and are you referenced by reputable mental health websites? And by that, I would focus more on consumer sites, right? Are you present on the WebMD style sites on the internet? Are there general health and wellness sites about maintaining sobriety for the long term and self-care, and someone on your staff, even if it's not you, is a contributor to that content? And then local news. You'd be surprised. Press releases don't need to be national. They don't need to be expensive. You can get local press if there's a local topic, right? And right now, COVID-19's impact on mental health. You could be the leader on that topic in your town, in your city, in your state, or still nationally. If I asked you right now, who is the national leader on mental health during the COVID-19 shutdowns, I think you're all struggling right now to come up with that name. Local online search. It's a lot easier to rank locally for some of these authoritative keywords than it is to rank nationally, but you can start working on that right now. You can start staking your claim now. And then channel and referral partnerships. If you don't have that platform, if you're a small private practice, but you have patient partnerships where anyone needing residential care or beyond your scope of expertise gets referred to partner A or partner B, perhaps they would be your publishing channel partner, and you contribute free content to them, an ebook on how to hold an intervention, underlying symptoms of withdrawal, how to know if a child needs to be sent away for residential care. Those types of topics, you can be the author and your partners can be the publishers. And again, think through trade organizations and associations that you could join and publish as a member, as a thought leadership contributor. So how does this turn into a game? How is this marketing, right? And really, we're playing an infinite marketing game, okay? You are crafting an image for yourself, a brand for yourself. You can become a leader even if you're not currently a leader. So playing this infinite game requires a certain mindset. You need to be improving your product. The way we build websites today is drastically different than the way we built websites 15 years ago, right? The internet's not even the same. So focusing on the improvement of your product, relentless improvement, is going to drive success. It's going to drive the mentality that will be perceived as leadership. And you don't measure your success against your competitors, right? All of the biggest influencers in the space, they don't even believe they have competitors. Who is Oprah's competitor? Who are the Kardashians' competitors, right? People that make it to an elite status of social influencer, whether commercialized or not, they don't really have direct competitors. They're trying to carve out their own niche, create their own following, and then lead those people. So success is really benchmarked against your previous results. All you have to do is more than you were doing yesterday. And when I explain the opportunity here that you can do that right now, that will put you in the mentality of an infinite game, of the perpetual process of improvement. I never make the same presentation twice, and that was a challenge given to me by a mentor long ago. But people say, hey, Dan, I never liked that college professor that gave the same talk year after year after year for 12 years. Don't be that guy. And it's difficult to come up with something new and to lend different types of expertise. But when you do that, right, your competitors are going to do what they're going to do. But that would mean your time is best spent improving what you do, right? Becoming an innovator, expanding your services or the topics you discuss from your services, instead of living in just that constant nerve-wracking competition with, and this is the key here, with variables you can't control. If anybody on this webinar has the ability to control Google Ads pricing, please call me immediately after this. But if you're all just using the same marketing channel with auction-based pricing, and it's a variable that you don't have control over, and that quite frankly, Google doesn't manually control, how are you going to outperform a competitor? How are you going to lead? You would have to simply outspend them. So when I say that you're your only competition in establishing authority, I don't mean that facetiously. I'm not saying that to inspire you. I'm saying that literally. There is an addiction treatment narrative that is not under control and is heavily stigmatized. And all you need to do is begin saying something today publicly that you were not saying yesterday, and you will make gains in market share, publicity, credibility, trust, and you'll have outcomes to share. If you don't know what to say to begin, if you want to do some social media today to test your courage and fearlessness, begin with questions. Ask others about their publications, their books, how they came up with their ideas, and what inspires them. And people love that. It's a consultative process. And just because you are courteous enough and professional enough to ask, they will allow you to participate in their infinite game. So how does that mentality benefit you, right? You're playing an infinite game. You need to get better and better and better. Cue any good 1980s training montage like in Rocky, where you're just training and getting stronger the whole time. But really, it's about setting a pace, right? You need some near-term goals that are easily attainable and some long-term goals that will be, at some point in your lifetime or career attainable. Your budget is a factor here. Your resources are a factor here. And so you simply need to begin, right? The business minds instinctively seek out the path of least resistance, right? How do I spend $1 in advertising and get a new admission? Well, that's a short-term strategy. That's the Hare mentality. And there's Google Ads and paid search and SEO and social media and all the things that I do for a living. But that's just one component. Those are near-term components to an overall marketing strategy. However, right, wouldn't you prefer to be perceived as Oprah, as a huge national brand where people credit mental health to your contributions and efforts? So these channels also require continual effort, ongoing budget, right? You need to commit to capital outlay, and they're going to pit you against competition, right? So the bigger you get, right, the bigger the target on your back is from direct competitors. So you need to lead through that, not directly compete against that, right? Don't think of the battle, think of the war. So developing evergreen marketing collateral requires only an upfront effort. If you write a book today, it has a shelf life of decades, right? If you document your strongest clinical protocols and speak on them publicly today, you won't have to document them again for a while, right? Stay innovative, but that documentation is your asset, your evergreen asset. And that will live in the background of the internet's collective conscience, right? When you publish a PDF, it's there forever. When you start ranking well for your name or all of your clinical staff's names or all of your executives' names, you're growing your reputation day by day, whether it's your corporate brand or whether it's personal brands. Either one is beneficial to your leadership. Collateral tends to be, this long-term asset. So publishing books or ebooks, they don't need to be long. Writing articles, right? Social media is the fastest and easiest way to publish an article, but media is media. So if you publish in the New York Times, thousands of people read your article, maybe millions. If you publish on Facebook and it's good, then thousands of people read your article, maybe millions. White papers, right? You can simply write a 3 to 5 page essay on your thoughts of the industry. And if people agree with your thoughts, they will widely distribute that white paper, and you will be invited to speak in many public forums and become a leader. So presentations, simple lunch and learn events, creating infographics about your data of any kind, just things that you find interesting, participating in podcasts. I have some competitors that run phenomenal podcasts, and I'm a fan. I listen to them. And any other long-term assets round out your online presence, right? So when you create an evergreen persona, when someone Googles your name or your company, and they find books you've published, articles you've written, white papers that you've generated, presentations you've done, I mean, these assets will be present because of the digital environment for a very long time. And all of those things, when you get your 5 minutes of fame or 30 seconds in the spotlight these days, when that happens for you and people look into you as a leader and as a brand, they'll find trusted thought leadership resources. Leveling the playing field. So I challenge every client with this, but be careful. Don't get caught up on comparing your practice or your facility or your team with these massive multi-location rehabs. We work with both. I've seen the one-person startup psychiatric practice that is more proud of themselves than anyone. And I have seen the heavily funded private equity groups yet acquire treatment programs for over $1 billion. And these multi-million-dollar marketing budgets, you don't need to go toe-to-toe as David versus Goliath. I bet if I asked you to name and rank the top 5 brands in addiction treatment, right, just the biggest ones, I don't think you would have any 2 lists be the same, right? There are names that would come up over and over again, but depending what region you're in the nation, it's not the same. So despite their size, these large commercial rehab organizations still have little to no brand recognition, or what I'm calling earned media exposure, right? How come we all know about the Mayo Clinic, Johns Hopkins, Cleveland Clinic? How do we all know about that? It's in our subconscious, right? Because they have been referenced and their research has been referenced in the media over and over and over again, right? I don't know if it's just local in Maryland where I am or if it's national, but all of the COVID outbreak tracking on a little red dots on the map of the U.S., that's all branded as Johns Hopkins research. I even know the software group that's generating the little red dots. So these groups that you might think are the big commercial threat or that they're years ahead of you on leadership, I strongly disagree. Their earned media exposure is the proof of that. You don't see the same person from whoever you think is the biggest operator on TV over and over and over again as the expert on the subject. These large enterprises have been unable or have failed to recognize the value in claiming this authority. They could do it with their resources, but the value in claiming that authority really comes from clinical thought leadership, right? So to claim that narrative, you need to be speaking from a clinical and outcomes-based perspective. Otherwise, it's just advertising and people won't trust it. So to stand on equal footing when positioning your center for long-term success, what you need to focus on is clinical thought leadership. And then you will be David against their Goliath, and you will get the publicity, and you will be known in the space. And they will know you, and they'll wonder, hey, these guys have a bootstrap budget and 1 clinical director. How are they out positioning us in the press, and why are they on the news every night and we're not? Well, here's why. Big or small, you can establish an A team very easily. I love it when a plan comes together. I also hope none of you thought we were going to get through today's presentation without at least one sweet 80s meme. That's my jam. So with all of this, I think you need to realize that your team can be big or small, but it requires a leader. And a leader needs followers. And I don't mean that under an authoritarian system. I'm simply saying that there is a game afoot, right? There's a tortoise and the hare. There's an infinite game mentality where people are striving to get to the top of their field, of their income potential, of publicity or fame. And with the winning strategy, you need to be out in front. You need to be the leader, right? But to be a leader, people need to trust your judgment. They need to see a clear vision and mission. And then that way, they're not just following you blindly. They're participating in your cause because there's a national epidemic killing tens of thousands of our family members. So think about that and how often and frequently you say it. Did you say to your team today that you're trying to save some lives and that they need to be diligent even if they're working remotely? So as a treatment center leader, this focus and this attention, it's going to be pulled in any number of directions, right? You've got normal administrative tasks. If you're on the executive team, there's just management of personnel and those issues. New protocols, new testing, new COVID-19 related issues. So on any given day, you've got these flyers to put out and your job to do. But to be a good leader, right, on your own is next to impossible. You need people that have a shared purpose, developing and deploying this thought leadership marketing strategy with you. My best example, to practice what I preach, today's presentation is the result of 6 individuals on my team contributing their specific skill sets towards a single final product. I blurted out a concept and something that's always bothered me about the industry, that there is no clear control of the addiction narrative nationwide, and that there is no definitive leader in the space, right? And my team responded. They helped me design this, and they know that I love my 1980s memes. It's usually Back to the Future, A-Team, something really good like that. You heard me mention Rocky earlier. And we scheduled internal meetings to plan out this content, to speak to some of our clients and deem what is relevant to their efforts so that we're giving good advice. So the individuals you choose to fill the requisite roles here, right, they're critically important. This collective, they're going to give you content that's simply better. It's going to be the sum of its parts. It's going to represent everyone's strengths, and you will be the leader of sharing that knowledge, okay? You can refocus your daily responsibilities when you have specialists working in their areas, their concentrated areas of expertise, and contributing towards the whole, right? So have that morning meeting, give everyone their key part of the project, regroup later to pull it all together, and you'll find yourself making those innovative strides forward. You cannot do it alone, and that is why there isn't a clear leader in the space. And I'll share a surprising opinion on that in a minute. So who do you need on your team, right? A leader needs this team, and I say followers, but really it's a team. You may be peer equals. You may be, lower on the totem pole in your organization than the people you need to help you, but a marketing or PR person, right? For a smaller organization, that might just be, hey, what employee do you have that's the most social media savvy, right? So someone taking on that role of public dissemination of information. This person needs to be in lockstep with your goals. They would need to be well presented. You would need to feel comfortable allowing them to speak publicly at conferences or to represent your brand. And you need to have your goals, your tone, and your personality completely aligned so that they speak as you would speak. This person creates a plan for distributing your marketing content. So it might be just social media in the beginning. They might be helping you to author a book, but the key function here is distributing that content, right? They might need to hop on the phone and make new partnerships and get that information out there. Assist in developing and polishing content and interact with the press and professional inquiry. So it doesn't have to be just you leading. It can be the organization, and this person can play a key part. A ghostwriter. By that, I simply mean somebody with better grammar than you, right? You might have a lot of great ideas for a book. You might be able to outline it, great ideas for a white paper topic and a few contributing variables, but you need someone to do the research that could understand your clinical and technical content. You need someone, you might have to go through a few different writers to get someone who can reproduce your tone of voice, your approach, the way you make bad puns and corny jokes like me. And then you need a publisher. And this can be a person or an organization, but professional guide to take you through the process of creating a book. Now, it's a lot easier to create an ebook these days than a published paperback book, so consider that. Hopefully you can find someone with some market connections, or you can tap into some distribution channels through a publisher. And a research assistant, right? They need to help carry the research load. They need to understand and produce outcomes data with you. So they need to understand, hey, what are we trying to get to? How are we going to present ourselves as leaders in the space? And they need to constantly track the key components that will help you speak knowledgeably on the subject. And this will allow you to create more than one of yourself. So the concept of having a protege or several proteges, right? This is a symptom that you're playing the long game. If you don't have a protege right now, get one. It will be a motivator for you to be more successful in your own long-term career. I mean that sincerely. But personal brand is important, right? But if you don't have an institution, if you don't have a legacy and a long-term value, then value leaves with you and success leaves with you. Coaching trees, like we see in the media, right? Professional sports is a good example of this, but in mental health and television, I'm going to use the example of Oprah, right? Expanded, right, through her mentorship to also have Gail and Dr. Phil and Dr. Oz and launch her own network. And that's how dynasties are formed. That is how thought leadership becomes brand, becomes media, becomes widespread, absolute, unquestionable expertise. And that will secure long-term success for your organization. So developing a culture can turn leadership into a system. and executive support. This is my assistant, Haley Nordyke. She's a superhero. I don't manage my own schedule. I'm notorious for triple booking meetings. Probably I would have had 2 or 3 calls scheduled during this webinar. So this dedicated professional will keep you on point. They need to have strong organizational skills. They need to have executive management experience. You need a handler, the same way a Hollywood actor would have an agent, right? The same way a professional athlete needs a manager. So hire to your flaws. I'm saying this as somewhat of an arrogant marketing guy, right? I have flaws when it comes to organization, and I'm admitting it to you now. So to become a thought leader, you're going to need that support too. You're going to need to identify which areas you're wasting your time on and which areas you're weak, and hire or outsource or freelance those components of your strategy to the most effective resources. And then let's look at partnerships, right? You don't have to do this all by yourself, all right? During your career, you have undoubtedly built relationships, right? Your work friends, your business friends, your colleagues, and your buddies at conferences. So think about how you can leverage those relationships. Maybe you can interview them about their thought leadership. Maybe they'd be willing to interview you and you record it as a video and post it on social media. Maybe you can share your research. Maybe you've always been embarrassed to share your AMA rate because you think it's so high. And when you talk to a colleague about theirs at their facility, maybe yours is better. And maybe you should have a whole panel series about that. Write a webinar, write a white paper about it. But sharing that research, you're going to discover more sources and more opportunities for cross-promotion. Making someone else famous will make you more famous, right? Oprah became discussed just as frequently, if not more frequently, when Dr. Phil became a household brand. So gain this respected and unbiased endorsement of your peers and express gratitude to contributing partners publicly. I've had plenty of partners in the space just ask me questions in open forums like LinkedIn or Facebook, and when I answer them, I am always gracious that they gave me the opportunity to be that expert. And that is press. You're getting press when you do that. The call to serve, and I'm going to bring you to a thrilling conclusion here pretty quickly, but why it matters. So if you're having success, if you're breaking new ground in addiction treatment, the world needs to know about it. I almost think you're morally obligated. If you have strong clinical care and you're running a good business, you've got to tell the world what's going on, because this is a major, major problem, and it's costing lives every day. So we tend to get so familiar with our own work that we assume people know about it, right? And that is a trap, and that is untrue. Your expertise is being siloed in a stigmatized industry. So as a pillar of your medical community, you have this obligation to market your success. You have to do this to establish and provide a clear source of legitimate treatment. You have to fill the leadership void on a large scale. There is a massive leadership void, and shut out the unethical voices. You need to stop patient brokering by providing patient education. And a lot of these unscrupulous practices in the industry could have been avoided with clear, thoughtful leadership. And then you need to create a reputation and trust to remove stigma and to mainstream treatment. It needs to be normal to go pursue treatment for mental health like it would be to pursue treatment for a dislocated kneecap or diabetes. So your to-do list really comprises, easy wins, right? You can claim today and take these first steps in the path to an expert status. But personal branding, you can buy yourname.com as a URL. You can update your LinkedIn profile to fill every single field as professionally as you can. You can create or update your public listings for your business, right? There's services out there like Yext is one, but even just Google My Business, Facebook, and LinkedIn would be where I would start that effort. Thought leadership. Get out a pen and a pad of paper. I know you got nowhere else to be because this is a, national global pandemic. So identify your areas of interest, expertise, and niches. If you were going to write a book or going to do public speaking, what would you speak about? What would you write about? Set a writing goal that you can stick to, a very simple pace. I don't think you're going to all write 10 pages tonight, but maybe you could write a page a week or a page a month and publish it when it's ready on your schedule. Identify colleagues who can become team members and partners of yours. Maybe they have the same goal as you. Maybe you want to lead and maybe they do too. Then work together as a team and let your company lead. But begin with short, single topic articles, right? Give yourself a tangible goal. Start off with your own blog and LinkedIn for practice. Get feedback. Email it to your friends. Get feedback. And then remember to incorporate keywords and phrases for searches so that your work ranks well on the internet. Then you need to build this audience, grow your following to be a leader. So connecting on LinkedIn with your network, becoming a connector, right? Offer to make introductions to others that might want to meet your network. But be wary of pretenders, okay? Just as there is a need for proven ethical treatment, there is also a need for ethical treatment marketing. And there is no shortage of marketing agencies, LinkedIn consultants, and self-proclaimed PR gurus in our common circles who will not hesitate to sell you consulting services with no basis in relevant addiction marketing experience. Just because they are able to discuss an issue does not mean that they are experts on that issue. So question these partners. Make sure that you're doing your due diligence, because if you associate yourself with a snake oil salesman instead of the next Oprah, that's going to be problematic for you. Their reputation is your reputation. So stay diligent. Now, where am I going with all of this? Who do I think is a leader in addiction treatment? Will the real addiction expert please stand up? Well, maybe it's not an addiction expert at all. Will the real Slim Shady please stand up? The real Slim Shady did stand up. So I want to talk about people that have effectively done the strategy I'm describing to you today. And Marshall Mathers, Eminem himself, was the best example I was able to find globally. This is a person who had the courage to use their public platform to share deeply personal experiences of addiction and recovery. Okay? What is the impact of that? What is their reach and influence as a leader? Eminem posts a picture of his 12-year coin, and 1.7 million people liked the image. And he just casually, socially said, clean dozen, in the books, I'm not afraid. Well, there's a very interesting timeline behind this, and I'm not referencing his celebrity whatsoever. I'm talking about media presence, leadership, and all of the strategies and tactics, a team, a publishing persona. And here's where he took that. Instead of writing a book and instead of being a clinical expert, he wrote music and he gave press interviews, okay? He has managers, he has handlers that do these things with him. He posted to social media through his entire recovery journey. He became aligned with Elton John, who he credits with saving his life. So there's your peer, colleague, thought leader, right? And then do you know what he did? He released an album called Recovery. So he became a voice to educate on the disease through song, right, his chosen media, and mainstream the acceptance of treatment. So from a well-publicized struggle with addiction to a well-publicized path to recovery, through finding people to help him that you would not have expected would be the ones to help him, he was then able to tell his story and directly market as a leader against stigma, okay? On his recovery album, he said, I'm not afraid to take a stand. Everybody come take my hand. We'll walk this road together through the storm, whatever weather, cold or warm. Just letting you know that you're not alone. Holla if you feel like you've been down the same road. So put to different music, this is a slow jam. Put to poetry, you might think that a clinical expert wrote it, just someone who's supporting anyone pursuing recovery. But I'm using this as my example. I'm using Eminem as my example because he does not have a commercial interest in the space. He is not doing this for his own benefit. He is using a platform, right, to communicate a very important message. So he has this platform, but no clinical expertise. And you have the clinical expertise, but no platform. You're the opposite side of the same coin. And so what I'm saying to you, what I'm trying to challenge you with is claim your authority and build this platform right now. And the number of patients you serve and the extent to which you can grow your business is limitless. You don't need celebrity to do it, but you do need thought leadership and to publicly tell your story and expand your presence and build that team to help you accomplish it. So for those of you that didn't know where I was going with this today, please realize that currently you would struggle to make the argument to me that there is someone more effectively being the national or international thought leader on normalizing mental health treatment, right? And empowering individuals to seek that treatment than M&M. So use your clinical expertise to build your platform. That is the opportunity today as we wrap up. We'll do a few quick questions, but while I hope you enjoyed this look into the importance of addiction thought leadership and the marketing plan that can drive it, we are excited to announce that there was such a buzz registering for this webinar and leading up to this, but I've gotten phone calls from industry veterans that are going to be participating in a follow-up panel. So please do follow Dreamscape on LinkedIn and subscribe to our e-newsletter through our website, and we'll let you know details on that panel series. Also, I want you to realize that there will be some related content shared at this year's National Conference on Addiction Disorders. This will be a virtual experience from July 30th to August 2nd, and there are some excellent sessions and presentations scheduled there. So while I'm disappointed to miss it in person and I won't get to see you face-to-face, maybe you'll get to see me on a video session. So I'm very happy that this event will still be happening, and I think that it's actually going to reach a larger audience online than ever. So normally when I conclude a webinar like this one, I like to mention the next conference I'll be seeing you all at. And because of the unique position that we find ourselves in today, I just want everybody to know that while we're remote from now, we're connected as ever. This is my team on your screen. We've been doing these company Zoom sessions, and it's been a lot of fun, kind of Brady Bunch style. But in addition to this webinar that will be available for you to download, my team and I are available for further consultation and advice. And now more than ever, if you just need to talk through your marketing, if I gave you any kind of new thought process today that you want to discuss and talk through and just see if you should pursue a certain direction, we're happy to do that. And my email is dgemp@dreamscapemail.com, and my direct line is 443-535-6997. And I'm looking forward to seeing everyone, to whatever extent I can, at the NCAD 2020 virtual experience. So very briefly, I don't think we have time for many questions, but let's see, we can do one or two quick ones. Oh, there's a lot of questions here. Let's see. Thank you guys, first of all, for submitting these. Some of these are very good. So if I don't have the kind of employee or team support available, do you recommend outsourcing? Or is the scale of my practice, let's see, is the scale of my practice not ready to expand into thought leadership? So let's say that you're a smaller operator or just an outpatient, group. I would say that, honestly, just begin. Just start working at a pace where you can produce content, maybe post it on your own social media and blog. And then as you identify, just start seeking out that team, right? Some peer influencers and some people to help you with content. And then as a last question, okay, what should I not do? What missteps do you see people taking that I should avoid? You said there are specific people to avoid. So what not to do? Don't be overzealous. Do not speak on subjects that you do not have expertise or experience in. So I would recommend starting with data and defining a pace that you feel comfortable writing out content, and really only speak to the data. Let the math dictate your successes as opposed to opinion. I think that there's a lot of risk in opinion, but I was able to tell you that Eminem's post got 1.7 million views. It's the math that I was referencing. It's the depth of his platform and social influence, not his opinions or character or leadership as a person. So in your own efforts, just be careful to not claim to be something you aren't. People can see that a mile away. So with that, I just want to thank everyone for attending today's session. It's been wonderful. And again, I thank you. Hope your families are safe and hope you stay safe. Take care, everybody.